Hello, we're here today to discuss the importance of properly using personal protective equipment, or PPE, to prevent the spread of the varicella-zoster virus, or commonly known as the chickenpox, among pediatric populations in healthcare settings. This is significant because varicella is a highly contagious virus, causing symptoms ranging in intensity, from a mild rash to death in severe cases. The generation of nurses currently entering the field have lived most or all of their lives in a post-varicella vaccine world and consequently could benefit from additional education on the nature of the virus and appropriate measures to take to prevent its spread. We have created this video module to include in nursing education to help bridge these gaps in experience and train future nurses. Prevention is always the best treatment, and rates of varicella in the United States have declined significantly since the introduction of the vaccine, but remain a major threat to vulnerable populations, particularly infants, children with immunodeficiencies, and unvaccinated children, as well as other non-pediatric populations, such as pregnant women and elderly individuals. Because the vaccine is a live vaccine, its use is somewhat more limited than others, and individuals with certain comorbidities or receiving certain medications are unable to safely receive the vaccine. Protecting these populations too young or too sick to be vaccinated requires other preventative measures. PPE includes a variety of protective measures intended to stop the transmission of infectious agents from one individual to another. In the case of varicella, where most healthcare professionals have been vaccinated or are otherwise immune to the virus, PPE plays an important role in preventing the healthcare professional from becoming an uninfected reservoir who could pass the virus on to another patient. So now we will demonstrate the proper donning and doffing of Tier 2 precautions for airborne organisms and explain the importance of utilizing these to interrupt the transmission of varicella and protect the most vulnerable populations. Unfortunately, due to the current PPE shortage, we will not be using the appropriate equipment, but will demonstrate the techniques of donning and doffing with appropriate modifications listed. The nurse is performing hand hygiene using alcohol-based sanitizer to kill any microorganisms present on her hands prior to putting on the PPE. The nurse is putting on the gown to protect her clothing and skin from any vibron particles that might land on her. The nurse is putting on an N95 mask, as opposed to a regular surgical mask. The N95 is specific to Tier 2 airborne precautions. N95 masks provide protection against small airborne particles as well as droplet protection. The nurse puts on goggles to protect her eyes. It's important to put gloves on last because they will be in direct contact with the patient and they should be aseptic. To doff the PPE, first, the contaminated gown is untied to make it easier to remove later. The gloves are taken off first, since they were in direct contact with the patient and are the most contaminated. Performing hand hygiene at this point in time is a good idea before touching goggles and other equipment close to the face. Next, the goggles are removed. The gown is then removed without touching the outside of the gown. It's important to keep the N95 mask on until you leave the patient's room so as not to breathe in any of the contaminated air in the room. In a hospital setting, the room would have negative pressure so that the contaminated air in the room does not escape into the hallway. Then, as always, it's important to perform hand hygiene before moving on to the next